Good day, everyone. I'm David, moderator for this webinar. I welcome everyone for today's webinar, which is Basics of Health Information Privacy Compliance Updates for 2024. I would now like to introduce our presenter for today, Paul R. Health. Paul R. Health, JD, is widely recognized for his ability to explain HIPAA rules clearly in plain language. I would now like to hand over the floor to the speaker. Over to you, Paul.
Thank you, Victor, and welcome to everybody. Well, this is really an interesting webinar, and it is something that is new, entitled Updates for 2024. It's really, in 2024, a continuation. 2003 has been quite a year in health privacy enforcement. Some newly active and aggressive enforcers of health information privacy law enforce HIPAA since the 2009 amendments to HIPAA and the HITECH Act are also becoming much more active. Let's consider this our agenda. What is happening in 2024? Modifications to the HIPAA privacy rule. And then we're going to talk about the Federal Trade Commission, which has just suddenly become alive. And the thing about 2024 is that you need to keep really up to date on what's going on. Blog, an essay, prepare for HIPAA changes ahead. So let's look at the HIPAA privacy rule modifications. In there, January of 2021, the proposed privacy rule modifications were published in final form. And comments mentioned that it's an inclusive process. In December of last year, there was also modifications proposed regarding substance use disorder. In April of this year, OCR made and published another proposed set of modifications to the HIPAA privacy rule regarding reproductive health care privacy. June of this year, the Office of Management and Budget, which keeps track of all of these modifications to administrative laws, published an agenda, and it involved, and they in these agendas they explain when to expect a pending rule to be made final. Let's talk about tracking technologies. They're used to collect and analyze information about how users interact with regulated entities. There are many types of these tracking technologies. It wasn't until 2022, federal regulators, the Office for Civil Rights and the FTC, focus heavily on two types of tracking technologies. One's called the Meta Facebook Pixel, and another is Google Analytics. What happened in 2022? In 2023, the American Hospital Association to OCR and objected to the December 1st guidance, and specifically internet and IP address should not be considered an identifier. That was followed on November 2nd by a lawsuit. That makes us take a look at what protected health information is. Where did it come from? How is it defined? There is where it's defined. And protected health information begins with information that identifies an individual. These are all 18 of them, and the Federal Trade Commission enforcement began with really in 2022, and the FTC carries a very, very big stick. What's really going on? Well, we have one set of laws that protect patient and consumer privacy, and those were created for a reason. Private lawsuits, data breach lawsuits, mount up over tracking technologies, state privacy laws. So the state attorneys general consumer protection, privacy, and data breach laws. They're joining together to investigate health information disclosures. 13 states have now enacted new privacy protection laws, and some of them. So we've looked at the planned privacy rule modifications that we looked at the way that the Federal Trade Commission has come in a major way. The new kid on the federal regulatory block, they are the biggest, the private lawsuits and state privacy laws. So I want to thank you for your attention. Wish you well in your compliance programs, and thanks for your attention.
Okay, thank you, Paul. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now and have a great day ahead.